Hello, everybody, and welcome to Ty and Sky's Health Pub. We are here today with Grace, an epidemiologist for the North Dakota Department of Health,
Hi.
and Jackie, prevention coordinator for the North
Hello.
Dakota Department of Health. What is oral health?
Oral health is a very important topic. Whatever goes in your mouth affects your entire body, which I don't think a lot of people take into sense. We really focus on trying to get people to go to the dentist, you know, because just to even get that one visit time a year, you know, that would make a great dent in a lot of things. But just brushing and flossing in general and just knowing and understanding what the mouth can do to the rest of the body.
Yeah. And I would just add, like, I think oral health is also overall health. It's not just like your mouth, it's your brain, it's the bacteria in your body, it's,
Yes.
you know, entire body.
Our phrase is it's all connected.
Yes.
Gotcha. So are there any sort of, if I don't take care of my mouth in particular, like if I don't, you know, floss, if I don't brush my teeth, if I don't do anything like that, what type of issues can I encounter for ignoring all of this?
Well, a big one would be cavities. You know, those are the bacteria harbors all the sugars and stuff that we intake throughout the day. So that would be a first thing that would start. And then once the cavity got big enough, then would include, like, you know, then it gets down into the main base of the tooth to where it's going to cause an infection. And once you get that infection, and if you don't take care of that infection, it will travel throughout the body. And so there has been cases of children that have died due to oral health because of that cavity not getting taken care of. There's even been cases in North Dakota where an abscessed tooth has linked to other infections. You know, pneumonia is a big one in long-term care.
Yep.
With the elderly, but there has been people that have been hospitalized that have gotten infections in their brains, or I used to work cardiac before I went in the dental health world, and that is a huge thing in dental is the heart too, because once we start doing valve replacements and stuff like that, and any infection in the mouth can actually go to the heart, and then we'll start rejecting and stuff like that.
That's a very interesting point that you make, and I'd just like to can I ask you a follow-up question to that?
Yeah.
So how do we get this bacteria from the mouth to these other parts of the body? Like you mentioned specifically heart valves, you mentioned the brain. How does it gain access to those areas from your mouth?
Because it's traveling throughout the blood. Our mouths have so many vesicles in there. The mouth is actually the fastest healing thing in the body as well. So typically if you have any cut, like let's say you're eating potato chips and you puncture your mouth a little bit just because it jabs you the wrong way, your mouth will be healed in less than 4 days.
Oh, wow.
Even with like severe burns and stuff. But your mouth is the fast. But it's also the inlet of everything where it travels. Like going back to cardiac, just how the tongue relates. You know, if you're having a heart attack, those people that have nitro, you know, you put it sublingual underneath the tongue because all your vesicles are right there. So it goes into the bloodstream a lot faster.
So I shouldn't panic if I'm eating like tortilla chips or something like
No.
that, you know, if I'm having some salsa, you know, because then, like, if
Heart
I accidentally
infection.
chip something or, you know, start bleeding, it'll just recover pretty quickly. So
Correct. Yep.
they're safe. They're safe.
Yes.
They're safe unless there's bacteria in your mouth that would be essentially entering your blood system through that cut.
Right.
Oh, man.
More to worry about. So,
Yeah.
so basically, what you're saying is that we have this bacteria, and particular bacteria can gain access to the heart by traveling through the blood system. And it gains access if you're cutting your mouth open, or if you, say, have a cavity that could dig down to an area where you might have, or maybe, because maybe we should explain cavities a little bit too, because I may not fully understand. So could you explain to us, what is a cavity?
A cavity is basically, it starts on the enamel, which is the outside of the tooth that we see every day that we try to brush and stuff. And once it gets through what we call that first layer of the enamel, which is also the strongest bone in the body, once it gets through that, we call it the dentin. And then that's where all the soft material is. And then it's like where it can just spread very fast if it doesn't get taken care of. And then depending upon how deep it gets, you know, the cavity before you get it taken care of, that's when it gets into the nerves and stuff. And that's will, once you hit the nerves and stuff, that's will give you the tooth pain, the toothache and stuff like that. And sometimes they're very unbearable.
Yeah, tooth pain is the worst.
Yep. And then sometimes if you don't get that tooth pain, and depending upon how that cavity has started, that's where the infections can start to play into role as well.
And I know for a lot of folks that experience tooth pain, generally, like some people will just brush it off, no pun intended there. But they'll just say, "Oh, I don't want to. I think it'll just go away in a few days." Is there ever any sort of time where someone should be generally concerned about? I guess is there a duration of time that if someone's tooth pain is becoming quite severe that they should get medical attention for it?
It's actually better if they would get medical attention before that tooth pain comes into play, because a lot of times when they have that tooth pain, then the infection has already started. That's a big sign of the infection already starting to take place. So then what will typically happen is a dentist will put them on an antibiotic. Well, once that pain goes away, then they think the tooth is fine versus getting that tooth treated. So it would be best if they, at much earlier stages, because there's a lot more things in dental with technology these days and so forth that we can do at a much earlier stage versus, when it's advanced, because we don't like to extract teeth. We want everybody to keep their teeth if they can. So.
Well, and maybe that kind of brings me to a question that I had, kind of a blunt question, but if I'm able to, with all the technology that you mentioned and kind of the ways we have now, if we're able to have have fillings placed and even get dentures if all my teeth fall out, I guess why take care of them if they can just be replaced? What's the benefit?
Dentures are, they're there. It makes people so that they can still eat and be able to have those normal things. But your normal dentition is still much better. Dentures, because of how a denture is made and stuff, so like on your upper teeth, it would, if you take all those teeth out, well, for us to make an upper denture, it has to be the mold of your mouth. So we cover the roof of your mouth. Well, for you to be able to taste, your taste buds need to hit the roof of your mouth as well. So that's how you get all. Well, once you put a piece of plastic up there, you don't have the same taste anymore. Your taste buds aren't the same anymore. The other thing is dentures sometimes just don't fit right, so then it makes difficult eating. They can get sores in the roof of your mouth too, which can make it very difficult. Lower dentures, especially depending upon the age, there's not a much lower jaw bone. So the longer you've had that lower denture, and let's say you got that lower denture at 40 and you live to be 90 years old, pretty much there's probably no bone left in that lower jaw. So the denture just kind of floats there. There's nothing really to hold it there anymore because you really need that bone structure. But it's much better to have your own dentition just for speaking purposes, healthier eating habits, and just...
And for your bank account.
Yes. Yes. Dentures are very expensive.
Oh, man.
Yeah.
Yep.
That's a very good point.
So if it is something that could save someone in terms of both their own personal health and then even their money in that regard, why do you think there's such a delay for people, or why is it such a secondary afterthought for people in terms of taking care of their mouth? This is my personal feel, and I feel that there's just a lack of knowledge with oral health. There's a lack of education out there. We, growing up, you're so stressed. With your parents or your caretakers and stuff, they always take you to your medical appointments. Medical's always been a very, you got to make sure you keep up on your vaccines. You got to make sure you keep up on this. If you have a broken arm, you go to this. Oral health, it just kind of gets left off to the wayside. Unfortunately, oral health is very expensive as well. So if you do live in tight financial situations, the medical is going to overtop dental. And that's why in North Dakota, we're really trying to do a lot of medical dental collaboration because of people going to their medical offices so much more compared to the dental offices, just to try and get that bridge there gap, the gap in trying to bridge that together. And then also just, stressing the importance in the medical world. Like, have you gone into the dentist at all this year? Or, have you seen a dentist at all? And just trying to, promote the education. Does that gap have anything to do with possibly the separation of insurances between like health insurance and dental insurance at all?
I think so a lot. Especially with like the ACA right now, the Affordable Care Act. Like you can go out on the web and you can pick up medical insurance, but the dental's not there, you got to specifically look for that plan if you want dental, because it's not one lump thing. Now, like our state plans, like Medicaid, North Dakota State Medicaid, now that's very nice for the kid. It goes from 0 to 21 if you meet those qualifications for that. But the one that is an encompass thing that has medical and dental, which is very nice. And I think that if we did offer more insurance plans like that, I think that would help people too.
Yeah. No, that definitely makes sense. And maybe since we've kind of already started bridging the topic, what are some programs that are available here in North Dakota that deal with oral health specifically?
We actually have quite a few.
Awesome.
We do a lot with access to care. So we have school-based dental sealant programs that we offer in the schools. The state ourselves, we have 42 schools underneath our umbrella, but then we have many partners throughout the state that also have schools as well. We have water fluoridation. Our state is 97% fluoridated, which is very good.
And sorry to interrupt you there, but why?
Fluoridation, water
explain that to
fluoridation
me.
is very good. Fluoride is a natural mineral that comes up through the ground. You actually can get it in vegetables and stuff in some of our foods as well. But what that fluoride does is helps remineralize the teeth. So if there's any areas that are can be weak, let's say the tooth structure is going to be weak due to sugars, or you're just not brushing that area, you're kind of missing that area, the fluoride will actually help remineralize that and get it back to its strong, healthy state. So it won't turn into a cavity if you catch it at the early stages.
Okay.
So drinking a lot of water here is actually a good idea then.
Yes, but not bottled
Yeah,
water.
you have to drink it from the tap. Yes.
Yes, because there is no fluoride.
There's no fluoride in the.
Yeah, there is actually no fluoride in bottled water.
Oh, no.
So you want to drink tap water.
I guess in that case, then, if for those of us that, because I know my family sometimes will have maybe like a pitcher where they'll have like a water filter or something like that,
like Brita.
and Brita, like a Brita pitcher.
Yep.
Yeah. Does that work still? Is that fine for?
Yep, that still
that?
works. It takes out some of the minerals and stuff, but it won't take out the fluoride. The only way you can eliminate fluoride from like your own drinking faucets is having the reverse osmosis installed in your home.
Okay.
Yeah.
Otherwise, all the minerals are still there. It might just filter out a few of the particles. Depending upon which chemical the water treatment plant maybe eliminates that, so it doesn't taste as strong.
Okay.
So
this is this fluoride is added to the water statewide in North Dakota. So anybody in any of the cities in North Dakota, does that also cover areas in the country?
Yep, because most of the countries now are on rural water. The only ones would be if they had their own well water.
Yeah.
But they still have fluoride in there. I just wouldn't know the content of it, but they could contact municipal facilities here at the state, and then they could send out a water sampling thing, and then they could send it into the state, and they'll test it, and they can tell you exactly all the levels of everything in their water.
Very cool. And is this something that's done nationwide, or is this something that's only done in North Dakota, or?
Nope, it is nationwide. Some states are less, fluoridated than others, but like Minnesota, for instance, our neighboring state, it's a federal or a statewide mandate, so they're actually, I want to say, close to 98 to 100% fluoridated.
Yeah.
Oh.
Well, and actually, I think it's a Healthy People 2020 goal to have water fluoridation systems in all the public water systems. And North Dakota has surpassed that goal, because I think the goal is like 80%, and we're at 97% of the public water systems. So,
Awesome.
Yeah.
And could I just get you to explain a little bit for us, what is the Healthy People 2020?
It's just a group of experts in the field of public health who put together these metrics that basically we're supposed to meet in 2020 to kind of like show that we're making progress in the health of the population in the United States.
Okay, so we can be sure that we're moving towards some goal, or
Right.
moving
Yes.
forward instead of, okay.
Yeah, exactly.
Are those kind of is that data that people could see possibly, or is there anything from this collection that we can say, oh, we're actually making like big strides in the field, or is it more of are the results just profession specific where like only people working in it would understand the results?
No, not really. I think with North Dakota, we're pretty accessible with our data. Like municipal facilities gives me the data for the water fluoridation. Again, that's, publicly available. And we put all this information on our website, the Oral Health Program website. And you can access that if you want to know about your community as well.
And we try to put a lot of our documents into user-friendly form, so
Yep.
it's not. So if you don't understand oral health completely, by looking at some of the bar graphs and just reading the executive summary, you would be able to understand. Yes, we are meeting some goals. No, we're not. So forth like that. So we make it
great.
user-friendly that way too. So it's not me as a dental hygienist or Grace as an epidemiologist. We're going to be the only ones to understand that paperwork.
Yeah.
Everybody in the community would be able to understand it.
No, exactly, and that's really. I'm glad that you bring that up. That's an important distinction to make, because I guess that was gonna be my question. I was gonna ask you, is this something that we're gonna read and it's gonna have so many of these high dollar terms that it's just gonna put me to sleep?
Right.
Yep.
Well, but I think we do a pretty good job, at least in our health program, because we have like a video on there, like talking about like the health of the teeth, and then we're moving into infographics, which is just like a one pager with like cute little, cartoons or whatever you want to call them that just make the information much more palatable to the public and also to people who don't really have the interest in reading a 20-page document. So.
Do you think that interest starts young, or does it start, because we were talking about like if it's a cartoon or if, we're trying to, I guess the idea is to market it to people that, hey, you should take care of your mouth.
Yeah.
Is this more of a, we need to make more cartoons, or like people my age going to still be like, oh yeah, I'll watch a cartoon on mouth health? Like, is it something like that, or is it,
I should have brought a sample, but it's just something that synthesizes like the information to a way that most people can understand. And it's not that it's dumbing it down, it's just telling you. It's kind of like the IKEA, when you have to put things together, like, when you get your table. I know it's torture, but they have those little cute, graphics that show you what this person is supposed to be doing. A goes into B. And so it's more of that as opposed to like just like,
I think what the infographics,
cartoons.
from my personal perspective, is the pictures draw you to read the information.
That too.
Versus you have one piece of paper with a whole bunch of words on it, and here you go, have fun, read it. Where the infographics kind of breaks it up a little bit. It kind of draws your attention in, like, oh, there's a picture over here. Oh, let's see what this bullet says,
avoiding death by PowerPoint?
Yes.
Oh,
yes.
yeah. No one should ever bring a PowerPoint anywhere. I think we should just kill it while we're on it.
That leads us to our PowerPoint on oral health that presented right here. No, I'm really glad to hear you guys thinking about that, because I know I find even in myself, like looking through my phone, there'll be a news article I'm interested in on some awesome new piece of home automation stuff.
Yeah.
And I can't even find myself getting through the article if it's all text.
Right.
Like
Yes.
it just phone's on the couch and I'm watching something on YouTube within 2 minutes.
Yep.
So
Really interested in it.
Well, and even on YouTube, you don't want an hour video. You want 2 minutes, right? So really knowing your audience and kind of like trying to figure out like what do they want to know, what's most important. And I think infographics, whoever started that, like have been really helpful for people in the healthcare industry, I think.
Yep.
So infographics and possibly even like shorter video segments, because we talk a lot about, especially running this podcast, of like media and the importance of health and media intersecting. So do you find that for something like oral health, is it something that people need to, is there a particular format that you find that people are very more receptive to? Is it more like a brochure thing? Here's a brochure, like take care of your teeth, or is it more like all right, we're here, live in an office, we're gonna show some dental dams happening, whatever happens, right? So like what in your opinion is more of the ideal situation?
I think just public speaking, whether, you go to a school and you're part of their activity, whether it's a back to school night or they do something, mid-school year, like a family fun night type thing, just making oral health fun, interactive and stuff like that. A brochure, no, that's going to go in the garbage.
Yeah, no one reads those.
But I just think getting out there and just being able to talk, because if you hand them a brochure and they have questions, who's going to answer it? The brochure ain't going to talk back.
Right.
So I just think being able, even like doing maybe a short infomercial, type thing, but being able to kind of just be able to speak to them, and maybe they would, I think they would understand better than a brochure. And sometimes I look at those brochures and, yes, they come from great backgrounds and stuff, but sometimes they get too technical where a lot of people don't understand them as well.
Yeah. Well, and I was just going to add, one thing that I like about her program, like what she does with the sealants, is you kind of like humanize dental care and oral health care in general. Because, I mean, let's be honest, some people are just scared to go to the dentist. Like, you can afford it, you have the resources, you have access to a dentist, but you don't want to go. But when you have, like, when there's a person there who is telling you, oh, I'm just going to do X, Y, and Z, like creating that level of comfort, especially for kids, I think makes a difference in how they might utilize dental care in the future.
You're right.
Yeah.
Well, that makes a really good point. And I guess kind of focusing our lens maybe more so on North Dakota. So it's something that we were looking at kind of during the research for this episode is we came across that in North Dakota, out of 53 total counties, which I did have to memorize in 8th grade. So that's coming back up now, Mrs. Schmidt. Thank you. And their county seats. Roughly 17, unfortunately I don't know the 17, but roughly 17 have no practicing dentists. So how can a state like North Dakota that has large rural areas, that has kind of a certain areas of the state that have no dental care access, what can a state do to increase this or to solve this problem?
That's where we've been trying to increase the access, like doing a lot of the school-based things. Granted that, targets more of the kids. But the one thing you got to look at is in those 17 counties, some of those counties don't have a large enough population to support a dentist because it is a small business. There's a large overhead with a dental office. But the residing county might have that dental practice. It is surprising to me, too, like how many schools that we do go to that are very far away, that travel a distance, but they want to come because they can do shopping. They can do multiple things besides just going to the dentist. So that's another thing. But we are, in the state itself, we are looking at ways to increase that access to care because there is some issues out there, like lack of transportation, so forth like that. But that is one of the ways that we're looking is increasing his access to carriers. And like I said, the one thing right now that we're really doing is the school-based sealing program.
Okay.
So.
And as an epi, I do have to chime in about the 17 counties. So we do have a map on our website that kind of like shows you which counties don't have a dentist. And really what I'd like to point out is like counties is not necessarily a good metric to measure access, just because what stops me who lives in Bismarck from going to get dental care in Mandan when it's only like,
Yeah.
So there are no like real boundaries in the state by county. And also like the other measure that's usually out there is the population size that's served by these counties, the 17 counties. And for the most part, they're not together. These counties are not aggregated in one place. So it's like these 17 counties don't have a dentist. They're spread all over the place. And like Jackie said, you need, 3,500 patients a year or so to sustain a practice. So if you can't, as a dentist,
if you only have a town size of 350 people, that can't support a dental office.
Right, and that would assume that all the people come to your clinic, because you may not be the nicest person.
So tell me if this is a terrible idea, but what about a dental bus? Like something like
we actually have one.
Oh my God, that's real.
You thought you were stumbling upon this like amazing, like mind-blowing idea for everybody here. And you're like,
dental bus.
we do.
have one.
It's called the Ronald McDonald Care Mobile.
Oh my
It's
gosh.
out there.
Yeah, you'll have to check it out sometime.
yes.
Does this help out? What's it used for? I guess what's the utilization for that?
It is dental. So, and they actually do the full scope of practice. So they are doing restorative, they're doing extractions, they're doing sealants, they're everything. You name it, they'll do it. It services 0 to 21.
Okay.
Because it is funded by, their main looking for is low access to care and the kids that are on Medicaid that can't find a dental home. But they service, I think it starts like at about Steele and then all the way to the western part of the state.
Oh, wow.
So
now we just need one for adults. Now.
yes.
I think that's
Yes.
great.
The 21
Yeah.
There we go.
Yep.
I don't know how many people would be interested in, like, it's like, you want to get, your teeth drilled on a bus? You want to? Well, is it moving?
Yeah, I feel like we could hollow out one of those party buses. So you'd still have the flashing lights and the loud music, but then you'd also have the dentist.
Oh, yeah.
Yeah, there you go.
Maybe you guys can DJ.
Yes, there we go. A brand new business venture. You heard it here first. The Tie and Sky Kickin' Dental Bus will be coming to a county or an area near you. But I guess maybe kind of some other questions that we had. One that Sky and I have talked about back and forth, and then we discussed a little bit before we started this episode, is teeth whiteners. So those were all the rage. When I was in 7th grade, I ran out and I was on those for maybe a year straight, because all my peers were at that time. Teeth whiteners, maybe the question I have for you first is, are they necessary for general dental health?
No.
Okay.
But I will say, though, I think there's current research that says that, your teeth basically determine your economic standing in the future, basically.
Right.
Like, it's very good for it's kind of like an indicator of social status. People with good teeth have better prospects at job interviews in the dating world. And I mean, it seems simple, but a smile is really...
Well, and that's oral health.
It's your first introduction to people, really.
And that's oral health in general, especially, if you're missing a tooth or, you got a large cavity on your front tooth or something like that. People are going to look at that, especially if you're in customer service, and say, do I want that person as, customer service? But tooth whitening itself is, no, it's not for your, to have for general overall health. When I was still working clinical, a lot of people would ask me about teeth whitening, and a lot of times is you don't want your teeth whiter than your eyeballs. You know what I mean? Because otherwise you go out there and that's the first thing they see is the bright white smile,
I didn't know about that rule.
Yeah. And then you don't want... the more you use whitening, it's very abrasive on your teeth. Mm-hmm. And so then it will start to cause a lot of sensitivity issues, which you created yourself. So just make sure, if you do want to do tooth whitening, that's fine. But it is very abrasive on the teeth. And if you already have sensitivity issues, it is not recommended that you would do it because it's only going to get worse.
What about, I guess, for other stuff like breath mints, for example? Like, are breath mints okay for, like, if I want to, eat them like candy? Is that that's probably bad, right? But, like, say if I'm about to go on a date or something, I got a really important interview coming up, and I want to make sure my breath is smelling fresh. Like, is there any drawbacks to, having the occasional,
No.
breath mint?
No.
All right.
Yeah.
I'm set then. For life.
You're set.
Sky's getting all of his personal health questions answered here today, too. But, hey, more power to you. So I guess, again, with the whitening, because this was a major growing up issue for me, does it have any effect on fake teeth or fillings?
Yes. So if you have fake teeth, whitening will not whiten those. So like if you have a crown on your front tooth and the other front tooth you want just a little bit of white or whatever, you start whitening, all your other teeth will whiten except that tooth with a crown on it. So even fillings, depending upon if you want to whiten, that's fine, but expect to get that filling replaced if it's a facial filling. Now, if it's on top of like a biting surface, it's no big deal. Mm-hmm. But if it's on the facial part of the tooth, so the teeth that you see, that will not whiten either.
Okay.
It has to be a natural tooth structure. And depending upon, too, there are instant cases where, remember the old teeter-totters at the schools? And sometimes kids would get hit and they would injure that tooth and then it would die, because the nerve was, And so for those teeth to actually get whitened to match because they'll turn gray and stuff like that, we have to do internal bleaching. So basically they'll drill a little hole in the backside of the tooth and put some bleach in there. And it's a many-step process. It's completely different than the normal Crest white strips that you would go into Target and buy.
Okay.
Cool. And I guess just going more into like this focus on the teeth themselves, like we've been told so often it's like, oh, sugar's gonna rot your teeth out, but is I guess, is it true? Like, I mean, I guess most of us would probably agree that it's true, but is there any particular foods that we should be avoiding, or any particular foods or drinks that we should be focused around for proper dental hygiene?
There is, but unfortunately, with the way that the world works today, you know, all the foods have sugars in them. There's so many preservatives in foods and stuff like that. Even, you know, your fresh fruits, they still have, you know, their natural sugars. So that's why you want to brush every day. But I would say you want to stay away from the foods that have high acidity. So, or even the drinks. So energy drinks, like that Monster over there.
Production team, what are you doing? Look at you.
It's very bad on your teeth. Mountain Dew, Coke, stuff like that.
Yeah.
Even like your Powerades and stuff like that, they still have sugar in them.
Yeah.
I'm not one to say that you need to totally cut everything out, because, you know, everybody likes to have something sweet in there. But it's just if you want to do it, drink it. And the other thing is I would say the worst part is sipping on stuff all day, because once you put something in your mouth, the balance, the pH balance in your mouth is already changing. So to get back to the normal state that your mouth should be in, it has to be free and clear of everything for 20 minutes to let that saliva kind of work and get everything. So if I take a couple M&Ms and I put some in my mouth, and then 15 minutes later I put a couple more in, and then 15 minutes later I take a couple more, or I have that Mountain Dew and I'm sipping on it all day, my mouth is constantly in acidic stage to where it's breaking at that enamel all day long, versus if I would just hurry up and drink it and let my mouth get back to a normal state.
So in a weird way, like a short period of binge. Oh, sorry.
Sorry. Seriously. So the way that I understand it is that when you're breaking down that enamel with the pH changes, it's also like the sugar which the bacteria are feeding on. And so not only are you like, you know, wiping away your enamel, you're also like introducing this perfect combination of bacteria that are feeding on the sugar that you're eating.
Yep.
And that's how kind of like the cavity process starts.
Yep. All three of those have to
meet together in a perfect and unholy trinity.
Oh. The unholy oral care. Oral health trinity.
Yeah.
So if that was just a short period of time, like say if I'm just like, well, you know what, I just need a snack or something, right? And then I decide that I'm going to have a whole bunch of sugar, but only in that like first initial 15 minutes. So that's actually better than if I would just, you know, sip on something the entire
For your teeth.
Clarification, yes.
For your overall health, a different story. But for your teeth, yes, you want to consume it within that first 20 minutes versus going at it all day long.
Okay.
Yeah.
And I guess for your in terms of how you guys both got started in this line of work, I guess in terms of mouth care, did either of you guys chew gum growing up?
Yeah.
Hey, how often did you chew gum? And if so, like what was your like favorite flavor?
I don't really have a favorite flavor of gum, and I wouldn't say I chew it every day. You know, sometimes it's just something to do, so I'll chew gum. But people that tend to chew gum every day can have effects on their jaw. So then they'll get the TMJ and stuff like that. So then they'll have a lot more jaw pain, which leads into headaches. They can have very severe headaches if you're a constant gum chewer, you know. So
I'm new to oral health, and I was never like a gum chewer until I started working with these guys. And, well, no, apparently, like the xylitol, the gum that has xylitol, it's actually good for you.
If your first ingredient is xylitol in the gum, that is the best gum out there.
Oh, wow.
Yeah.
What
so
is
now
that?
I chew that.
Xylitol is a natural or herbal, like...
It's like from the rubber plant. Like
Yeah,
the plant
but it helps fight against bacteria and the sugars and stuff like that.
Well, that's interesting.
Gonna have to go get some of that.
And I guess to follow up our gum question, if you were a type of milk or a flavor of milk, so we'll go flavor and type, what milk would describe you and why?
I'm not a big milk fan, but if I had to pick one, I'd pick chocolate.
Okay.
Just because it's sweet.
sweet. I think I would pick coconut milk.
Coconut milk.
Coconut milk.
I just love anything tropic.
Awesome.
Yeah. It just reminds me of sun and happiness. And I would like to imagine that's what I remind people of, you know. So, yeah.
Whoa, perfect.
How about you guys?
Oh my gosh.
Oh, geez, we write them and we. You go first.
Okay. I'm actually allergic to milk. So funny enough, though, and I have my EpiPens around here.
Down here.
Down here. Yep. Know where your EpiPens are at. I think my favorite type, or I guess if I was a milk, if I had to be, I'd want to be almond milk. Probably because it's just something. Because you can also go like vanilla almond milk, and you can just be really.
Lots of varieties.
Yeah. So I don't know. I just want to. I don't know. A lot of people like almond milk, so it's just I like it in cereal sometimes. I don't know if cereal's the healthiest thing to be eating, but
No, there is good cereals out there.
Some good cereals, huh?
Yeah.
So like if
Not
I guess
Captain
not.
Crunch. No. You don't put that in there.
Darn,
I
have to change.
Sugar
I have to change up my entire. It's 3 bowls a day.
Straight cereal.
Yeah.
Just do it before the whitening, you know.
Now I learned I have to eat all 3 bowls at the same 15-minute interval.
And then just not eat again the rest of the day.
Yep.
Till lunch. Then it's 15 minutes. You
Yep.
better consume that.
And as long as I chew that gum afterwards, I should be okay. I should be okay. Don't do that.
Okay, so if I could be any type of milk. So initially I was going to say strawberry because I used to really like it, but I changed my answer. It's banana milk.
They make that?
I guess. And why I say banana milk is because I love bananas. I have banana yogurt every morning. Fun fact. And
What brand? No.
I'm curious. I've never
we have
heard
it
of
right here. Sponsor of our oral health show is Greek yogurt by Chobani. Here you go, Chobani for the whitest tea you've ever had. Thank you. We should be good to get paid now. But yeah, and banana milk is weird.
Okay.
And I think I'm weird.
Well,
I think
now
other
we
people
you are.
perceive me as
You have been known.
yes.
First they're like,
Been made known.
he's the most normal person on the show. Not anymore. You took the
I'm
crown.
rallying against that. I can't be the normal one.
No fun in that. Being normal.
But no, if you haven't had it and you're not deathly allergic to it,
Yeah.
and you find banana milk, try it. Let us know what you think, and you guys let us know what you think.
Yeah.
Very curious. I'd never heard of it, honestly.
Yes. But yeah, and on the topic of banana milk, what's the differences between rural and urban areas dealing with oral health? What unique challenges do we find in rural areas versus urban areas?
There you go, Grace.
So I would say in rural areas, just like she said, it's just like, where do you even find this dentist? If there is one, how many patients are they seeing? So is it going to take 2 months, 2 weeks to get an appointment? And that's fairly common for people residing in rural areas. For urban areas, like say Grand Forks, Fargo, and Bismarck, we do have like more dentists per capita than most cities. And the challenge there seems that they're just not willing to take low-income patients. And so if you don't have private insurance, I would say that's the biggest challenge if you're living in an urban area. In the rural areas, it's can you find a dentist? And will
Okay.
the dentist take you?
No.
That makes sense.
I guess in then the urban communities as opposed to the rural, and as North Dakota is mostly rural.
Yeah.
Do you find that there's actually are there more issues of dental hygiene, I guess, or more like mouth health, I guess would be the more proper term. Is there more issues of mouth health or concern in the rural parts than there are in the urban, or do you find kind of that it's just kind of similar?
I think my personal perspective on it is it's pretty similar. You tend to see the trends more in your low income and underserved kids, whether they reside in Fargo or they reside in Carrington. They tend to have the same, the troubles of getting into a dentist and stuff like that. The other ones that have higher needs of care as well is our American Indians. So
And that's exactly what the data reflects. We do these surveys of oral health for children and older adults, and for both of those surveys, the most recent data that we have, it basically just shows that we don't really have that difference in rural versus urban. But when you look at the racial groups and income levels, then you see a very clear disparity. And really, there's just kind of like that meeting of minority populations and poverty, and they tend to be the most affected by oral disease across the board.
So if we were to maybe focus in on that, kind of what you just mentioned, are there specific state programs that maybe focus on these groups, these minority low-income groups that are kind of hit the hardest?
Yes.
That's we work with Department of Instruction. We get their free and reduced free school lunch program. Data results every year. They're technically a year behind to get all their information and stuff, and that's how we rally up our schools for what we're going to serve. The one thing too is with our program is once you're in, you're not out. So even though they might fluctuate a little bit, which can very well happen, especially out west with the oil, you know how it goes up and down. So, but we do service public schools. We have BIA schools, which is Bureau of Indian Affairs, so on the American Indian reservations. And then the Ronald McDonald Caramel, they serve quite a few of the American Indian reservations as well.
Dental bus.
Yeah.
And
there you
what
go.
she's referring to, are you guys familiar with the National Lunch School Program? The school
I-
lunch
A
program?
little bit.
A little bit, but
Oh, okay,
we should
'cause-
have you explain it. Yeah.
Yeah, well, and what I was going to say was her program, I think, goes above and beyond because you target schools that have more than 40% of their students enrolled in this program. And so
Okay.
you're getting like above and beyond what is considered like in the poverty level.
Yeah. So it's the whole population of the school, they get extra federal dollars if they're on that free and reduced free. But there's a forms that you have to fill out at the school, and then that it's all income based or whatever. So it would help the families out. Like if they don't have the financial means to pay for their child's school lunch, then the state would kick in with those extra federal dollars, and so that
Okay.
child would still get meals every day.
Okay.
So it's basically kind of targeting out like where the school falls at to get the extra federal dollars.
Right.
Okay.
And when you show up to the school, you see all the kids, not just
Yep.
the kids who are
Because
on
it is
the-
a state program, so
Yeah.
we provide services to everyone that they have to have a parental consent, because it is we're doing direct services, so we have to have an active consent. So if they don't have a consent, then we can't see them. So any child that has a consent, whether they have a dentist or not, because we are a state program,
Okay.
can get services in the school.
Well, that's really cool.
And I guess in terms of with all these programs running through North Dakota, what would you say are some of the things that North Dakota is getting right in terms of oral care? Like, is there anything that's kind of like, I guess, our gold stars for like North Dakota? What's like the thing that we could be very proud of in terms of like health outcomes in terms of dental care?
Well, aside from the amazing staff, obviously, I will say, even though, there are challenges. I mean, the main disease in public health, at least in my opinion, is poverty. And when you target people at where they are, you're removing the barriers of transportation, you're removing the barrier of access, you're removing the inconvenience of taking time from work. And so I think by having these programs like what Jackie does, which is you're actually going where the kids are, it definitely mitigates a lot of the issues that could be preventing people from seeking care. Because you do see some kids who are so far down the road that you don't even know when they started, and you're just basically trying to get them to see a dentist. You can't even deal with the issue they're having right now,
Right.
because it's the disease is so progressive. So
And the other thing is that we are a rural state, so we are spread out, but yet we're a small state. So we have a lot of great working relationships in our state. I know there's lots of states that can't even talk to their Medicaid department, where we have that nice working relationship. We have a great working relationship with our dental association. So even though the state has their sealant program, I've got it to expand to 9 community health centers and private dentists within the state to help get the access to care, bring that access to those schools and stuff to help out their communities. So I think that is a big thing for our state. We haven't gone that far yet. So for North Dakota itself, I would say that's a pat on the back. The other thing that we are doing too is bringing portable equipment, which is what we bring into schools, but also to the long-term care facilities and providing care to those residents versus having them getting transported out, which can be an issue. So that's another thing that our state is, you could say that is up and growing.
And we're looking into teledentistry.
Yeah.
Teledentistry. Could you explain that to us?
So that's where it kind of follows along with telemedicine, which is kind of rolling out faster than teledentistry. But so we would be able to take portable x-ray machines, and we could take x-rays on the kids, or intraoral cameras. It's like a little wand basically where you can snap a picture if there's something that looks suspicious or anything, and then we can send that back to the dentist and then have them review it and then get a better treatment plan or a diagnosis, or if the parent comes in to get that child, then we've already talked to the dentist on the other side, so then we can explain more in detail what's going on and the importance of getting this taken care of right away.
That's very cool. So you said that's kind of up and coming here in North Dakota?
Yep.
Okay, very cool. Yeah, and I really think it's interesting to look at how tech, we can really reach out to the tech sector to try and solve some of these issues of access to care specifically.
Oh, yeah. Yep.
Because like we've been talking about, and it's kind of been brought up a few different times throughout our talk today, access is a key piece
Yes.
dealing with oral health.
Yeah.
Kind of a follow-up to Skylar's question. So we've talked about our gold stars in oral health for North Dakota. So we have to do the flip side. What are the rotting, decaying wood stars?
What's a demerit?
or what could be improved?
What could be improved? I think there could still be some improvement with different associations, coming together as a whole and trying to make North Dakota better versus fighting against each other.
Okay.
I do think that is one of our could be improvement. I still think there is improvement in access to care that we could be doing, getting people into the right areas and stuff like that, whether it is teledentistry once we get that rolling and stuff like that, or, getting more people involved with the sealant program. I will say it's a very hard issue. It's nothing that we can do, and I don't think Medicaid could really do, but there still are a lot of kids that could be on the state plan, Medicaid, and I don't know how to get them enrolled so that they can get the services they need and stuff like that. That is a huge barrier.
And on the flip side, when they do get enrolled in Medicaid, get the dentists to want to participate. I mean, most of them are excellent, but we don't have all of them on board. So it would be great to have them actually be welcoming of these kids who obviously need these services.
Perfect. And I guess kind of a question to follow up on that. As an average citizen of North Dakota, what are the benefits to me of supporting programs like the ones you've been talking about today?
I look at supporting these programs due to then the kids, the children in our state that are, growing up, if they could get those services at a much younger age, they don't go through life in pain. They're, have more self-confidence, especially with today's society with bullying. The suicide rates are very high. If your mouth brings a lot out in a person. If I was to come and see you and I see you got this big black hole in I'm going to be looking at that, and I'm looking at that, and so that brings your self-confidence down and stuff like that. If you tend to see a lot of young kids that just don't smile, there's probably something going on in their mouth. So I think that would be, those are huge supporting issues, but just once again, just making sure, because if you incorporate oral health and the importance of it at a young age, I think they have a better life outcome, and as growing up as an adult, they'll still get that care, and then once they start having families, that will be incurred into their minds as well.
So it's a snowball.
Yeah,
Yes.
I totally agree. I think supporting these programs, you're really supporting these kids so they can support themselves in the future. Because if they have that, sense of confidence, because tooth pain, you can't concentrate in class if you have tooth pain. And so just kind of pushing that message and the resources throughout the life course, I think it produces, adults who can self-sustain and who can in turn support other kids who are struggling with this issue. So
So it's just not, I guess, for a person looking at it in the financial aspects, like, oh, I got to pay for these programs. Yeah. So it's not just to them, like, this is a great explanation to say, well, it's not just, like, oh, I'm not paying for, Ty over here to have his mouth cleaned, like, it's like, why can't he clean it himself, like.
Yeah.
Well, far too often you're paying for issues that have gone much further than just like brushing your teeth and and the cost effectiveness. This is one of the most cost effective, like sealants, one of the most cost effective public health inventions ever.
Yeah, it's evidence based, and if they have a 90% effect rate, if they stayed retained within that first year, they will last. Like, I still have my sealants.
Do you guys know what a sealant is?
No, maybe we need to describe that. Yeah.
So how I explain it to the kids is it's basically we put it over the biting surfaces of the teeth because there's so many grooves, like on your back teeth. There's lots of grooves and stuff, and it's harder to keep those grooves clean. And so when all that bacteria will sit in there, and that's how you get the lovely cavity when that tripod comes together. But basically, it's like we look at it as a fingernail polish that we put over the tooth. So we put like this, what we call as etch. It kind of cleans the teeth, and it's an acid etch type thing, but it cleans the teeth and gets all the bacteria off. And then we rinse it and we dry it really good. And then we put the fingernail polish over. It's white. Some of them are opaque, some of them are clear. There's many different type of sealant brands out there. And then we cure it with the blue light. Remember Kmart with the blue light special?
Oh, yeah.
So we put the big blue light on there, and then that's cured, and you're good to go. And then, like I said, it has a 90% effective rate. So now you have, instead of that groovy surface that was hard to clean, it's nice and smooth. So you can just brush everything off, so you're not as prone to cavities. Not saying that you still can't get a cavity, because there's still in between your teeth and stuff, but on the biting surface of the teeth, they are very, very effective.
Yeah, and it seals off like the oxygen, so the bacteria are not like breathing in there and like creating like the small cavities. So
So even if there is like a small cavitation, like a little cavity is trying to start, and we seal over it because we're not aware of it because we don't have x-rays or anything like that, but visually it looks like a good tooth, that will, like she said, will cut off the oxygen supplies, which is feeding that bacteria. So now they'd have nothing. There's no feeding frenzy going on anymore. We cut all that off.
So you'd have to try like very hard to like actually get, I guess a cavity if you were like taking care of your teeth and like I have to, I'm gonna have an entire bag of jelly beans or something. I'm just like,
you have to want that cavity. To work
it's like,
for
gotta
that
work
cavity.
for it.
You gotta work for it.
I have dental insurance. I want to make use of it.
exactly.
And maybe along those lines, so if we were to put out here an oral healthy person or an oral healthy lifestyle, what components or what makes up an oral healthy lifestyle for people?
Well, the first one would be brushing and flossing.
Okay.
So brushing twice a day, and you want to brush for 2 minutes. Not 20 seconds. It should be 30 seconds per quarter. And then flossing one time a day. And then just healthy eating habits, not a lot of processed foods, not that Monster Energy drink all day. No. But just a healthy eating habit. Not saying that you can't splurge every now and then, but just having that healthy lifestyle, but the oral health. And then getting once a year an annual checkup.
Well, and Jackie, the one thing I wish my dentist had told me when I was a kid was to get sealants, because I've had to pay later on in life or get fluoride varnish. Those are things that when they don't think that you're at risk, maybe. Or what is the criteria for being given some of these things?
They're really on the sealants any day and age now is any child that has those permanent molars. There is no really, yes, we want them on the higher risk kids, but I feel that all kids are susceptible to cavities no matter what their level is, just because of how they take care of their mouth. Yeah. But sealants should be placed in my mind, in every child's mouth. Right. Once they get permanent teeth, that's the big thing.
And that's something for the dental bus to do. Just bring the
dental bus.
They do those.
So they're gonna come to your kids and we're gonna take care of that, because it's very
blue lights
very
and
important.
all.
Blue lights and all. Yeah.
And I guess kind of to move us along here as well, how can I or any kind of citizen of North Dakota get involved to improve oral health kind of statewide or community-wide?
I would say just really, promoting activities, even if you aren't in the oral health world, maybe you know your dentist. And if you have a child in school or something, just doing fun activities, promoting oral health. If you're in the medical world, once again, promoting oral health. Have you been to the dentist? Look inside their mouth. If, something's going on, don't exclude the mouth out of your whole physical exam, because a lot of times there are things that going on inside the mouth.
Do you think it's more of a, I guess, kind of a family and more friend kind of oriented social group in terms of trying to get people grouped towards, going to the dentist? Like, I guess in the family, it's like, oh, well, Ricky, you better check up on your teeth there because, it's not looking so good, like you need to go out there. Do you think it's more something like that, or is it,
Well, the idea, I think, is for Ricky never to have gone into that point. You should
Right,
be taking
right.
Ricky to the dentist before that.
All right, so
But-
talk to Ricky beforehand.
Well, but the one thing that I think, and I've seen this like in other countries, I think the UK is a good example where the dentist and the doctor are in the same same location. And so when you go for your annual physical, you're also going to the dentist. And I think that would go a long way in kind of like making people normalize that practice of like, this is totally normal. I don't have to wait 2 years to go see the dentist if I can afford it.
Or you can, like, a short-term phrase, a one-stop shop type thing.
Yeah, yes.
Community health centers like Family Healthcare Center in Fargo, Valley Community Health in Grand Forks, they have medical and dental all right there. IHS, Indian Health Services, they have medical, dental, they have psychology, they have their pharmacies. They're all in one building. So if you could have like that, all of that right there, I think people would tend to go to the dentist as well. Mm-hmm. Just because once you see it, then you're like, oh, I haven't done that part yet. Yeah. Where if, all your independent practices, you could drive by them and not even really pay attention to them.
Yeah. This could be your systems of care questions too, because you can ask them, how can we kind of like combine the communication where like, because my doctor never asks me if I've been to the dentist. And same with the dentist, like that conversation never comes up. So having them kind of like communicate would be a great way to.
That's a good point, especially with like the way that a lot of doctors specialize too. So it's kind of like they were like only concerned about their one particular field.
Yeah.
So maybe just you're talking about maybe just a little bit less of a sectioning off, at least checkup wise, or if there's something maybe you talk about one of these specialists realizes during their exam that they could remind the patient about their oral health as well, especially if it's an issue like we talked about that could connect to oral health, like your cardiologist might talk to you about that, or your ear, nose, and throat physician.
Yep. And there are starting to be more dental schools that are combined with medical schools, where the med students and the dental students actually take their first 2 years together and then kind of break apart. So they're actually learning the same curriculum and get to work side by side versus this med students at this college and this dental students over at this dental school. So they're kind of even bringing that together too.
Yeah, and I do see, major benefits, I guess, for everybody with improved communication, specialty to specialty, or even provider to provider.
Too.
Yep.
The medical records, like if your dentist had access to well, I don't know if I want that, but if your doctor had access to your dental records, that'd be great.
Well, and vice versa too, because sometimes when they do come to the dental office, they leave out important medical conditions because they look at it as, well, you're not my medical doctor. Why do you need to know? Where if we had access to that record, then we're not doing anything that could possibly jeopardize their health care as well because they left that out.
All right, and did you happen to have any other parting thoughts for us before we head out? Was there any sort of thing that you'd like to let people know? Like what in your opinion is the most, if there was one thing to take from this discussion, what is the most important thing for someone to remember?
Brushing your teeth twice a day.
Brush your teeth.
For 2 minutes.
Set the timer, just set it, just 2 minutes.
Is there a good 2-minute long song that we could set that to? We'll have to research that.
Yeah.
Good one.
That'd be your brushing song.
Yeah, yeah.
Probably do have something like that, the brushing song.
Yeah, they might. Some toothbrushes out there actually do have timers set on them. Like they'll beep as you're done with each area of the mouth. So
Things are getting so advanced with technology now.
that's right.
They really are. I think they have ones that have cameras too that can take a picture.
Really?
Yeah.
Dentist.
Oh, that's cool.
Yeah. So, well, at least that's the way of the future.
You just have to find a dentist that wants to keep getting emails from them.
Yeah, so, oh.
I checked it out today. Is it still okay?
I'm still going to start billing you.
Oh, yeah. That's,
Per photo.
Or start the mouthy revolution.
yeah.
Yeah.
You know. But, well, yeah.
Right. Well, thank you guys so much for joining us again. It's definitely been a very insightful conversation with you guys. I learned a lot more today, like even the dental bus, like that's really cool to find out about.
Skylar's major
intrigued about
takeaway,
that.
the dental bus.
This is going to happen multiple times in my life. Where it's like, why haven't they done that? They already did. So yeah, that's definitely good to hear though. It's then rather it be just a dream. It's like I'm delusional. But yeah, no. So thank you guys so much again for joining us today. For the viewers at home, please, if you happen to have any sort of questions for Grace and Jackie here, please just give us any questions below in the comments. Like, subscribe, and also if you happen to have any other major points to you that are very important about oral health or any sort of revelations, please let us know those as well. Any other thoughts?
Oh, that sounds great. We'll catch you guys on a future episode of Ty and Sky's Health Pub. Thank you for joining us today.
All right, and have a good one.
Thank you.
See ya.